Today we are going to talk about the anatomy of thorax. Before we begin the lesson, like and subscribe to our channel and turn on the notification bell so you will get notified when we upload a new video. Skin. Superficial layer. Superficial arteries arise from the perforating branches of the following arteries: internal thoracic artery, posterior intercostal artery, thoracoacromial artery, lateral thoracic artery, superficial veins, thoracogastric veins, lateral thoracic veins, cutaneous nerve, supraclavicular nerves, cutaneous branches of intercostal nerves, the arteries and the lymphatic drainage of the breast, vessels, arteries, lateral part, thoracoacromial artery, lateral thoracic artery, posterior intercostal artery, medial part, perforating branches of internal thoracic artery, veins, internal thoracic vein, axillary vein, posterior intercostal vein, the lymphatic drainage. 1. The lymphatic vessels of lateral and upper parts drain into the anterior group of axillary lymph nodes. 2. The lymphatic vessels of medial part drain into the peristernal lymph nodes, and their efferent vessels drain into the anterior mediastinal lymph nodes or supraclavicular lymph nodes. 3. The lymphatic vessels of inferomedial part anastomose with the vessels of the anterior abdominal wall and with subdiaphragmatic and hepatic lymphatic vessels. 4. The deep lymphatic vessels drain into the apical lymph nodes. The intercostal spaces. The intercostal muscles. Intercostal sexterni, intercostal cinturni, intercostals intimae. The relationship of the intercostals nerve and vessels. In the costal groove of the rib, the arrangement from up downwards is the vein, artery, and nerve. Skin. Superficial fascia. Deep fascia and superficial muscles of the thoracic wall. Intercostal muscles. Internal thoracic fascia. Parietal pleura. Mediastinum. All the organs and structures between the mediastinal pleurae are called mediastinum. Divisions. Superior mediastinum, inferior mediastinum, anterior mediastinum, middle mediastinum, posterior mediastinum. The main organs from anterior posteriorly are the thymus or its remnant, right and left brachiocephalic veins, superior vena cava, right and left phrenic and vagus nerves, aorta and its three branches, trachea, esophagus, thoracic duct, ductus arteriosus triangle. Boundaries. Left pulmonary artery on inferior side. Left phrenic nerve on anterior side. Left vagus nerve on posterior side. Contents: left recurrent laryngeal nerve, arterial ligament, arterial duct in fetal life. Inferior mediastinum. Anterior mediastinum. Contents: lower part of the thymus, the internal thoracic vessels and their branches, a part of the anterior mediastinal lymph nodes and loose connective tissue. Middle mediastinum. Contents: pericardium, heart and roots of great blood vessels, archovasagous vein, phrenic nerves, pericardiophrenik vessels, cardiac plexuses and lymph nodes. Posterior mediastinum. Contents: the principal bronchi, thoracic part of esophagus, thoracic aorta, thoracic duct, azygous and hemiazygous veins, vagus nerve, sympathetic trunk and lymph nodes.